So would you tell them, I know I have your history, would you tell them the reasons that I'm going to be working on you to see if I can help you? What is it that we're dealing with?
Most immediately, I've been having lower back and hip pain. Almost exactly 2 years ago, I had a little boy who was just over 10 pounds and had a normal delivery, but after the delivery, had a lot of lower back and hip pain, especially when I would lie in bed or roll over. I went to about 6 weeks of physical therapy that gave slow, measured improvement, but have had flare-ups of it since then. Also, on that, it's mostly on my right side, and about 5 years ago, I was thrown from a horse and landed here on my hip and lower back and had a nasty bruise there for several weeks, and hadn't had any other real injuries to that side other than that. But here, as I've been home and sleeping, home visiting my mom and sleeping in a new bed, I've had a really bad flare-up of it again, and she said, gotta come see if you can work in with John's schedule. So I'm here. The worst of my flare-up was about Tuesday, Wednesday. I've been stretching it with a lot of the stretches that I was given in my physical therapy session, but I'm still feeling a lot of pain as I try to walk.
Okay.
Other questions?
On a scale of 1 to 10, how much pain there is right now?
Currently, if I'm standing still, I'm aware of it, maybe a 1, but no terrible pain. As I try to twist or if I jump on it on impact, I'd say it goes up to a 3 or 4.
How much of the pain that you have, during the childbirth process, in your mind was a similar, if not the same pain as you had when you hit yourself landing from the horse throwing you? In other words, those were the same area, but in your mind, was it the same pain, even though the mechanism was different? Did you say, oh, that's the pain from when I was thrown?
I didn't recognize it. No, I didn't recognize it.
How would you differ? Same area, but how is it different?
Now on reflection, there was some similarity in the effort when I walked and my weight shifted.
Mm-hmm.
I think that, having given birth, I was associating it with childbirth or just recovery.
During childbirth, I don't mean to interrupt you, but you're saying things I want to. During childbirth, did you have back labor?
No, I didn't have any. I didn't notice any special pain
Or
during the
tailbone?
Nope.
Did you have any trouble sitting on your tailbone after delivery?
No.
Okay, so you've not had any tailbone pain at all?
No, some slight soreness extending down kind of my spinal area into the tailbone. And when I had an x-ray, the physical therapist ordered an x-ray, and it showed a lot of swelling in the sacroiliac joint there. But nothing.
On the one side?
Yes.
For sure not the other side, or they didn't image the other side?
They didn't image the other side.
Okay. How old are you?
I'm 28.
So, in high school, did you ever have to bend over and try to touch your toes, like flexibility testing?
Sure.
What could you do then?
I was about average. I could
Which
touch
is
my
what?
toes.
You could touch your toes?
Mhm.
Can you now?
I think.
Good.
Yeah.
Okay, good sign. So, remember what I told you? I said right away that clears the fact that the hamstrings aren't participating to try to stop her. Probably not a coccyx issue where she wouldn't do it because the dura wouldn't want her to stretch that far. And it's not just how far she went, it's how fast she went. Just boom, right on down. So, now, what did they do for you just briefly with therapy? You said you went for 6 weeks? And what did they do?
It seemed to be a lot of stabilization exercises. They had me flexing the transverse abdominis. What is it?
Yeah.
Is that it?
Yeah.
And doing the thing where you're on your knees and hands and rotating like that.
Kinetic control.
They gave me a printout of exercises that I've done off and on. So
They didn't do anything to treat your sacroiliac joint?
no. They said the best thing to do was to try and stabilize it.
Okay. I disagree.
Well, it hasn't been terribly effective for me.
Okay, now,
So great.
so for the sake of argument, how many muscles are there that can stabilize the sacroiliac joint? None that I know of. Okay? Anybody know of any that I don't know? There aren't any muscles across the joint. Huh?
Yeah, they say that transversus abdominis cancer, but
I know that, but I'm talking about at the joint
There's
itself.
there's no muscle deposit.
Okay, now listen to what she said, because I'm picking up things and I hope you are too. X-ray evidence at an early age that she has some findings on imaging. You with me? You wouldn't expect to see it at that early an age. Now, we don't know what the other side looks like, but chances are it's only on the one side. Now, we don't know to what extent that means that that joint's been injured before and it's already starting to have changes in it. Okay? Now, remember that joint has two parts to it. There's an auricular part and there's a synovial part. To the extent that there are little, you know, like Velcro, the male and female parts of Velcro? So the anatomist at USC a number of years ago did a study on the sacroiliac joint and did some imaging and found that there can actually be fractures within the joint of these, the way the joint actually comes together, like Velcro, and you can't see it on any imaging studies. But what you would see potentially is an inflammatory process associated with that. So that could have been something that happened from the original injury, and it could have taken a long time and then the birth to trigger it even further, because obviously the sacroiliac joint, you had a vaginal delivery?
Mhm.
Yeah. So what has to happen with the sacroiliac joint at birth? It's got to move, right? Okay. Plus the last trimester, when you go through the stages, the ligaments become a little more lax, preparing, right? The relaxing. Okay. So what I need you to do is, if you would, while you're sitting, let me just test you while you're sitting here. Arms crossed in front of your chest. We're coming to this. I'll be showing you this in a little bit. How many of you test thoracolumbar rotation for the patients sitting? There'll be a good reason for that if you haven't been to see now. Does that bother you at all there?
Feels good.
Feels good. How about this?
Same.
Okay. So on your back with your head up here. Okay, legs down. Okay, good. And what do you do? I mean, are you working, or are you a mom, or what do you?
I'm in law school and I'm a mom of 2 kids.
Okay. Well, because you're in law school, I have to be real careful what I do with you.
No. I do immigration
There's a treatment
law.
for everybody other than lawyers, and there's a lawyer treatment that we do.
Shouldn't have said it.
I have one lawyer joke, only one that I can remember. There's a lot of lawyer jokes out there. Have you heard the one, what's worse than 365 lawyers at the bottom of the ocean? You know the answer? More.
Better. What's better?
Is that better or worse?
What's better? Okay. Anyway, here we go. Let's see what you got going on here. Okay, this is your sacroiliac joint here. You with me? Let go, let go, let go. There you go. I'm going to spring that. Do you feel it moving?
Mhm.
Okay, now we're going to test the right one and see how that feels by comparison. Does that feel the same to you when I try to do this over here?
No.
Does it feel stiffer?
Yeah.
Is it more tender?
Yes.
All along there?
Mhm.
Okay, that's hardly moving.
Not a bad thing or a good thing or
Well, it's a bad thing if we can't fix it, but it's a good thing if we establish that it's not moving and then I do something that's better. Then that's a good thing, okay?
Okay.
But this is our baseline. This is how it's supposed to feel. It flops all over the place, right?
Mhm.
Okay, that side is very resistant to movement. Now, typically if the sacroiliac is involved, what about the adductors? Aren't they going to be facilitated? So if I check the adductors here, no big deal. If I come in over here, are you a little bit sensitive over there?
It feels a little bit tight, but
How
not
about here?
sore.
Well, I can feel the difference between the two. See how that yields when I push
Yeah.
in there? Check symphysis, because sometimes symphysis will be injured when you have a jarring injury, but not on her. So far so good. Not much in the way of erector spinae activity, so that's a good sign. I wanted to check to see if there was anything on this side that when she landed, she might have had some splinting in the obliques. Not there, that's a good sign. I'm going to come in and check gluteus maximus. Did that bother you all up in there?
No.
Good. Nothing here?
No.
No? Good. Okay. So, what I want you to do, I can see if I can fix it, but I'm gonna show you something, that if this works, you can do this for yourself, which would be nice, wouldn't it? If you had something you could do to help it.
Yeah.
So here's what we do. I want you to make one leg long and the other one short. But wait a second. But I want you to do it slow enough that they can't see you doing it. That means the speed of it has to be so slow that they can't observe what you're doing. So go ahead and start when you're ready. One leg long and the other one short.
My shoes are squeaky well, so the front row can tell.
The front row can tell.
John, do you see a lot, like with her, that iliopsoas would also be giving you kind of a false positive on the SI?
Could be, but if I clear the SI, I'm
And
going
then-
to right away.
Right, so sometimes I clear the SI and then it still feels stiff, and then I go to iliopsoas and it cracks.
I just want to see, because I want you to see if this works, that, have you done, are you only done one leg so far?
Yeah, it was
Oh, you-
going really slow.
Okay, let's do the other leg. Go ahead, do the other way. Really slow. How many of you ever done this as a home exercise for SI? This, I gave this to my accountant. Remember I said I treated the accountant and did the, turn the head for the diaphragm? I gave him this for the SI, corrected his SI in a matter of just a couple minutes. Has to go slow. If you go too fast, it won't work. So it's got to be slow enough that you don't elicit any reflex activity. Tell me when you've done both legs the same. Meaning you've been through the cycle in both.
Okay.
Where are you going to go to law school?
I met New England Law in Boston. Okay.
You did it?
Mhm.
Okay. Let's see if that made any difference here. Well, this is what I did a minute ago. You ready?
Mhm. That's a lot looser.
Is there anything?
No,
No.
a little bit right.
A little bit right there.
Mhm.
Right there?
Yeah.
Yeah. That's where the gluteus maximus is attaching, all along here. Now we'll check the psoas, okay? So I'm going to check the muscle right in here and see if that's okay.
Mhm.
Not a problem here. Bend your knee up here for me. A little bit further up. Okay, I want you to close your eyes for me. Now what I want you to do is I want you to begin to lift your butt off the table here. Can you? Now let go. Back down. This is what I just did a minute ago. Does that feel any different now?
The pain is not as much for the discomfort, but it's still a little tender feeling.
Can you turn on your side, face me? Right in here.
What's the area it's been tender?
This in here?
Mhm.
She has some fascial restriction along that lip of the iliac crest that the gluteus maximus and even a part of the minimus is attaching to. This is like stabilization, just a little different. Does that feel different there now?
Yeah, it does.
Like it glides now?
Mhm.
On your back and I'll retest it like I did a minute ago.
That feels much better already.
That's a good sign for you, you can palpate, they tell you that?
Just turning over, I can tell the
Yeah,
difference.
yeah. Now, I'm going to reset the adductors so that I'm going to take away the facilitation she had there, because she may have had that for a long time. Eyes closed. Just push out a little bit against me here. I'm going to facilitate that by using one of the abductors. Now let go. Good. see if there's something still going on here where she has more, is this at all tender over here?
Close tight.
Yeah, it is. She has, I mean, I can see the difference. Can you see it from there? Do you see how much convexity, fullness here, and how flat this is by comparison? Can you see that from there? Well, you come up so you tell them that you see what I see. Even if you don't, tell them anything.
Yes.
You see the difference? Okay.
Good call,
What did he say?
Yes.
And you checked the psoas earlier and it was fine?
So, there's potentially some increased activity here, even though she's not telling me about that. This is an example where you've got to look outside of what they're telling you, because otherwise you still focus on what the patient tells you. You can focus on the area they're talking about. But I had a sense that this didn't look right even from here. This looks like a differently developed thigh than this one. So either this one needs to be more developed or this one's facilitated. And I think this one might be facilitated. And part of that may be coming from, let's see how this is done in here. Is that tender down here at all? How about in here?
Yeah.
Yeah? Vastus lateralis? Why could that be involved? Because when she hit here, some of the force could have been translated through the iliotibial band and then into the vastus lateralis. You follow the logic on that? So, all I have to do, remember the technique where we hook the patella? I want you to just begin to tighten your kneecap a little bit more. And then we just karate chop that, like that. Now let go.
Not tight.
Not tight.
Better.
Looks a little better, doesn't it, from here? Yeah.
You can see much more of her left leg right now than her right leg. Before, the right leg was very,
It
like you
was-
said, much more developed.
It had enough height to it, you almost couldn't see it, right?
Right.
That's a good sense from where you are here. Yeah, and it's definitely laying more flat and relaxed like this side is. Okay? See, the pressure's on me, not because you're gonna be an attorney, but because your mom is working on my website. And if I blow it
You might
right,
stick some bug in there.
yeah, the old website might be an improvement over what your mom would do if I don't really make a good thing happen for you here.
I don't think so.
No, I don't either. You've
She's
already told me.
already a big fan.
I-
She'll blame it on me if I
Yeah,
don't.
okay. That helps me a lot that you would say that it won't be my fault. I'll tell her you said that. All right, let's see what else we might have. Okay, we also have rectus femoris. Did you feel that in here a little bit? Or is it not too bad, or
Yeah.
a little bit there? Here's the same muscle over here. Does it feel the same, or does it feel different?
That's different.
Like I can go back and forth, almost like I'm strumming it, right?
I'm a harpist.
Are you? Well,
I
okay.
know about
All right, so you know about that.
string tension.
Better not try to talk to you about something you don't know that much about. Eyes closed. Close your eyes here. I want you to like dig your heel a little bit into the table. So we're going to get her to fire the hamstrings a little bit harder. There you go.
This way?
That's it. Now let go. Oh, that's much better. How does that feel now?
Feels good.
Yeah. See it healed now? That's the way it's supposed to feel. Up you come.
Bunny hop? It does feel good. And I can lean over without trying to clench everything and groan. I can turn.
Any pain when you jump?
Great. Pardon?
Any pain when you jump?
When I jump? No.
Go walk,
Do what?
go walk.
Go walk. No, it's fine. Anything else? Did it hurt?
Feels
Yeah.
good. No, it doesn't hurt to walk. It doesn't hurt to do anything. Thank you very much.
Now, the reason you're better is the stabilization exercises.
Guess I have to keep doing them then.
6 weeks of stabilization exercises, right?
This takes some teaching.
Now, another work.
So
Now.
the leg lengthening.
Yeah, now, listen carefully, because here's what I've got to tell her. We have known findings on imaging, don't we? And who read those?
The radiologist.
And do you have the report?
I do.
You could send that to me,
Okay.
because I could at least get more. I don't need to see the x-rays. I'd like to see the interpretation of what it showed.
Okay.
Did it say any more than what you said, or is that all it said?
It just said, no, it didn't really.
Inflammation?
Inflammation of the
That was the
SI
only word
joint.
they used?
Inflammation of the SI joint. And it suggested testing for the rheumatoid arthritis that
Right,
since my mom
right,
has
and
it.
you have been tested, and,
Mhm.
okay, good.
Should we have her get her woodpeckers going then?
Yeah, I mean, we could, but I mean, if she's 100% right now, I don't even know that I would bother that, but yeah, normally I would add that to what
Right.
we're doing, okay? For the sake of time, I think we're okay with what we're doing. But what I want to tell you that I'm going to tell her is, knowing what we know about the imaging study, that means that if the left one doesn't look the same, which you said we don't know, correct?
Right.
If it were me, I would at some point get one of the left side to see if you're seeing it bilaterally,
That's a good point.
because that's early to have it showing, unless trauma caused that,
Mhm.
to start seeing those changes. Now, this becomes your home program, this lengthening thing.
Mhm.
In bed at night, before you go to sleep, just, a couple of cycles of that, going as slow as possible. The slower the better. I mean, literally the slower the better. Because you were able to make the change without me doing anything. Just you, because what that did is that was causing a little bit of torquing of your sacroiliac joints when you were doing that, which is all it needed.
Yeah,
It's all it needed. Now, I mean, there's a few other things we did, but that was the major change.
yeah.
Remember?
Mhm.
You got up, laid down, and you said, oh, that's better already.
Mhm.
I hadn't done anything. You did it.
Yeah.
Now, it's because of that imaging finding that you may have to keep that moving.
Mhm.
Because if you don't do deliberate motion like that, and you just use walking, let's say, as motion for it, walking happens so quickly that the joint may not go through its full range of motion, so you may start to lose motion again in the future.
Ah.
The way to keep it is to do that every night before you doze off, a
Mhm.
couple of minutes, just nice and slow, just like you did here. And if you're faithful about it, it may go on to move for years to come, or decades to come. It may not become an issue. But that's the reason I think you have to keep doing it, is because I think when you were thrown from the horse, you've had some trauma to the joint. The
Mhm.
trauma is showing up slowly over time. The birth stressed the joint even further.
Yeah.
And now what we have to do is, like we've done here, is restore motion. Let your body see if it can go on to improve as far as the healing of the joint to whatever extent that can occur. And then you would hope 5-10 years from now, give another x-ray, it doesn't look any worse.
Yeah.
That would be a good sign if it didn't look any worse. But the joint can go on to fuse, which is what you need to know about if you're not moving.
Okay.
An injured joint, an injured sacroiliac joint can go on to spontaneously fuse.
Mm.
Not typically till it's somebody my age,
Mhm.
but if you've had an injury to it, that sets in motion the stiffness issue in it, where it doesn't want to move. Does that make sense?
Yeah, it does.
Okay. Anybody else have anything for her?
Thank you very much.